This
waiting
conference
to
will now be recorded.
Yeah. So thank you for being present today. I'm Sara Moraca, and I'm glad to be here with two really outstanding professionals that work in the field of climate, planetary health, and human health. So it's my pleasure to introduce Marie Studer, that is senior manager of the Planetary Health Alliance at Harvard, and Vincenzo Lionetti, that is professor at the School Sant'Anna of Advanced Study. So our event today is scheduled in the following way. Marie Studer will be the first to come on stage. Then Professor Lionetti will introduce some more concepts on planetary health. And then following my brief session before we pass to the question about the importance of engagement. So Marie, I would like to give you the stage.
Great, thank you. And let me share my screen. And Sara, just let me know if you can see my slides.
Yeah, I can see your slides.
Great, thank you so much. And thank you all for having me today. This is a really important and exciting event, and I really appreciate being here with everyone to talk about planetary health and climate change as well. To set the stage for this conversation and for our further discussion, I want to introduce you to planetary health, which is both a scientific field and a global movement focused on understanding and quantifying the growing human health impacts of global environmental change. I also want to mention that planetary health also is focused on developing solutions that will allow humanity and the natural systems we depend on to thrive now and into the future. Planetary health is the understanding and appreciation that intact and thriving natural systems are directly related to human well-being. As you can see from this quote, that all things are connected, including human beings, to the rest of nature. And planetary health is a unifying concept that ties these two aspects together and simultaneously means human health and well-functioning natural systems. In other words, we don't have to say human and planetary health, as they are one and the same. So briefly, some background on how we have arrived at this urgent moment in time in which natural systems are crumbling and are no longer able to safeguard human well-being into the future. We can see that over the past several decades, humanity has made many public health gains. We have seen decreased child mortality, increased life expectancy, and the amount of people living in extreme poverty has decreased significantly. But along with that growth and that increase in public health and well-being has come similar increases in consumption patterns, and consumption patterns which really have grown exponentially over the past several decades. Whether we're looking at how humans and the amount of which humans use water, how they have new and increasing proliferation of motor vehicles and transportation systems, our fertilizer consumption, paper and plastic production, and certainly our energy use has increased nearly exponentially. Associated with all of those increases, we have also seen accelerated human impacts on natural systems. And in this slide, you can see that there are these similar exponential patterns of biosphere degradation or marine fishery capture or carbon dioxide going into the atmosphere. This exponential growth has led to a sevenfold increase in population growth since about 1870, And our gross domestic product, or how much we spend, has also increased by 11 times. With this rapid population growth and even steeper rate of per capita consumption, we've now collided with Earth's natural systems beyond what the Earth can support. So in other words, we are no longer living within our planetary boundaries. And with this growth, we are changing the environment dramatically. And it's not only our climate. So to feed ourselves, we converted about 40% of land surface for croplands and pasture. We've also used about half of the accessible fresh water for human uses. We've cut down millions of square kilometers of forest, dammed 60% of our rivers, and we have increasing air, water, and land pollution, as well as climatic disruption. We're also losing species that share this planet with us at an alarming rate. And these changes don't sit or happen in isolation. All of these changes impact our public health gains and affect most dimensions of human health. So, for example, extreme temperatures contribute directly to deaths from cardiovascular disease and respiratory disease, especially among elderly and marginalized people. We also see, of course, with the pandemic, infectious zoonotic disease increasing, and we see mental health effects associated with eco-grief and other disruptions. And with all of this change, we see civil strife and trauma, forced displacement and migration, all of this which impacts human well-being and the ability for us to live with wellness into the future. So in other words, we've mortgaged the health of our future generations to realize economic and development gains in the present. This statement comes from the 2015 Rockefeller-Lancet Commission report on planetary health, which called for action to address these urgent issues. It called for creating a transdisciplinary field focused on creating the evidence base connecting human health and environmental disruption, and it called for creating an entity to galvanize the community of planetary health practitioners. Planetary health provides a new scientific lens and a unifying framework focused on understanding and quantifying human health impacts of global environmental disruptions. So as you can see on the left-hand side, with increases in rapid population growth and steeper growth in per capita consumption, we have large environmental impacts at the scale of activity now outstrips the planet's capacity to absorb our waste or provide resources that we would like to use sustainably. And as a result, and through our human systems of society and culture and governance, we are transforming not only and disrupting most of our planet's natural systems, but those disruptions interact in complex ways to impact every dimension of human health, which you can see over on the right-hand side of this slide. Now, planetary health is this really helpful framework, as I said, and it brings together all dimensions of environmental change and focuses it sharply on human health. And what makes planetary health unique and applicable across the globe is that it deals with the urgency scale of both the problems and solutions. It is both a scientific field and a social movement, so that knowledge to action can be created, and it's transdisciplinary, and addresses systemic causes. And this is important because we know that achieving planetary health will require something called a great transition, or where we do just about everything differently. How we produce and consume our food, how we construct our lives and lives in our cities, and also even the stories that we tell ourselves about the place in our world and our relationship to nature. So the Planetary Health Alliance was born back in 2016, coming from the Rockefeller-Lancet Commission report, and we're based at Harvard, as Sara mentioned earlier. We're a consortium of over 250 institutional members from 57 countries, and we have now over 1,200 individual members, which we just opened up starting in April. Our mission at the Alliance is to promote, mobilize, and lead an inclusive field of planetary health and its diverse science, solutions, and communities to achieve that great transition. And we do that through encouraging and empowering a diverse global planetary health research and knowledge community. We facilitate education and training of next generation planetary health practitioners. And we work on mainstreaming planetary health science, stories, and solutions through outreach. And through that, we promote actionable steps. We have many core initiatives, whether they are related to clinicians for planetary health or our campus ambassador program, and we've developed planetary health curriculum, and we also hold annual meetings of the planetary health community. We have resources that are freely available to anyone who would like to have them, and you can find them by coming to our website. But I'd just like to highlight a few ways you can begin to get involved, and I'd like to invite all of you to become either an individual and/or an organizational member of the Planetary Health Alliance. It's completely free, and by doing that, you can access our online community on Hilo. You're welcome, and we invite you to join our new European Regional Hub, which is one of 10 hubs around the world. And you can do that, again, if you become an individual or organizational member. Use our free educational resources. They're there for anyone to use. And go ahead and share the new Promise of Planetary Health video, which is now available on our YouTube channel. And certainly, please feel free to follow and amplify us on social media. I'm going to leave it there, but I'll leave it with this question about what can we do together on our planetary health journey. And with that, I'll hand it back to Sara.
So thank you, Mary, for your presentation. And I'm glad to introduce Professor Lionetti, that is going to follow the discussion on planetary health, climate, and health. So, Professor Lionetti, I leave you the stage.
Thank you, Sara, and thank you for this great initiative that honor me a lot. So first of all, I'm saying that I am an anesthesiologist and my main field is related to cardioprotection. I have no conflict of interest with this event. And why I'm interested in cardiovascular disease? Because it's the leading cause of death worldwide, more than cancer. But if you look specifically, cardiovascular disease is the leading cause of death in a middle-income country, a low-income country, and in high-income country, cancer causes twice as many deaths as cardiovascular disease. This proportion is maintained except the COVID-19 pandemic time, where of course COVID-19 is the main cause of death actually. And cardiovascular disease is also a main topic in anesthesia and intensive care because we observe several deaths after surgery due to perioperative myocardial infarction in people without any kind of injury into the heart or in people at high risk of morbidity related to coronary artery disease. And as you know in this picture, the cause of onset of perioperative myocardial infarction is related to physiological factor by even the perioperative withdrawal cardiovascular pharmacotherapy, but even a risk factor, a comorbidity like the environmental factor. This is a huge issue since heart disease have implication for the more than 300 million people undergoing non-cardiac surgery worldwide every year. So what are the new risk factors that are coming? Because we are investigating on this issue since 20, 30 years, and we are still there. We can say that apart unmodifiable risk factor related to gene, Over 70% of cardiovascular disease worldwide is caused by modifiable risk factor. And the main one are metabolic risk factor. The second one are behavioral, like lifestyle, physical activity or not. As you can see, environmental now is the third modifiable risk factor that can cause cardiovascular disease in the worldwide population. The global warming, as Mary said before, is a relevant issue. And in this recent study conducted among Chinese adults, we can say that long-term exposure to temperature variability plus 5, 10, or 15 degrees Celsius increase the estimation of risk of cardiovascular disease, like you can say. And people much more frail to this kind of events are older people. So as you can see, for cardiovascular disease, stroke, and coronary heart disease, the percentage of lost disease-free years is progressively reducing below 16 years old. So we can detect even a population that is much more at risk. But the cause are not the same around the world. Like you can say, recently, Lancet published a study, a pure study that showed as the proportion of cardiovascular disease cases and the cardiovascular mortality change in different countries, like low-income country, middle-income country, and high-income country. And we can say that exposure to household air pollution is much more related to cause of cardiovascular disease and morbidity and mortality in low-income country and not in high-income country. That's why we need global strategies, need to take a local, a tailored approach. We cannot talk about a worldwide situation, but should be much more focused regarding regulation in specific country. Air pollution means exposure to particulate matter. And you can say the particulate matter can have different dimensions, less than 0.1 micron, and then equal or less than 2.5 micron, or equal or less to 10 micron. We are more, we identify that the particulate matter with the size less than or equal to 2.5 macro is the killer that can destroy our cells into the cardiovascular system, and the effect are related to the concentration. Like you can see in this map, the low-income country, they have a higher concentration, like a microgram per cubic meter. Look, North Africa, Bangladesh, India, Pakistan, some area of China. And this is really interesting, but this is also related to the regulation of each country. Like you can say, if you consider the threshold of the WHO interim target of the PM 2.5, you can say that the threshold is smaller in the US compared to the European or Indian. And if the threshold of the maximum concentration allowed increase, you are much more exposed to risk of cardiovascular disease. So the primordial prevention related to regulation law is really important. This is another example related to the change of the climate and related to the change even to the cardiovascular risk factor exposure. Look, this is a map of China, and the brown and darker area means that you have a higher concentration of particulate matter 2.5, so higher concentration of pollutants. And you can say on the right side that by increasing the concentration of particulate, increase the risk for cardiovascular disease incidence and cardiovascular disease death. And this relationship is maintained even on the effect related to the perioperative time. Like you can say that increases climate pressure, like increasing temperature, increasing natural disaster, rising sea levels, but more air pollution can induce an effect, a dramatic effect on perioperative care. So climate change actually is an issue of perioperative medicine and anesthesiologists too. And we know that the exposure to air pollution induce an inflammation, a chronic inflammation, a oxidative stress that involve the heart, but the brain too, through the deregulation or dysfunction of the autonomic system. And the determinants, the biologic intermediate, are inflammatory or pro-oxidative or related to hypercoagulation state. So you have a thrombotic activation with a clotting into the coronary artery that leads to myocardial ischemia. So blood flow stopping. But what are the mechanisms? Till now, we were focused on this view: oxidative stress, inflammation, cell injury, the onset of cardiovascular disease. Recently, the discovery of new mechanism focused on epigenetic related changes. Epigenetic life involve before the birth, so during the embryonic development and lactation, and still during adult life. And we know that during embryonic development and lactation, factors as maternal lifestyle, specific phenotype of mother and placenta can affect the development and the onset of some disease. But and during adult life, living place where you live, so environment is really important, the workplace where you stay much more time during the day, pharmacological treatment, medication, diet, or exposure to toxic like alcohol, tobacco, or asbestos can promote the onset of different disease, even cardiovascular. But it is not enough. I mean, we need to consider the exposure to a safe environment or to an harmful environment, because the story changes. If you are exposed to safe environment, you have much more opportunity to have a normal development during your pre-birth life, or you can have a delayed aging and normal ontology development during your adult life. Conversely, if you are exposed before your birth to harmful environment, you are much more at risk to develop metabolic, like diabetes mellitus, for example, or mental disease in adulthood. Even exposure to harmful environment can induce cardiovascular disease during your adult life. So it is much more important the time when you are exposed during your life, you are exposed to environment, to air pollutants. And what is it, epigenetics? It's the study of heritable change in gene function that do not involve change to the nucleotide sequence of DNA. And when a cell undergoes mitosis or meiosis, the epigenetic information is stably transmitted to subsequent generation. We estimate till the third generation. And the epigenetic control at an extra layer of transcriptional control, it means that doesn't change the sequence of DNA, but you can modulate the expression of gene due to chemical modification like methylation, acetylation, ubiquitination, or the expression of microRNA. These are really silencing factors that can modulate the gene expression in different areas of the chromatin. So we can recapitulate that the exposure, the long-term exposure to ambient air pollution can promote epigenetic regulation. Actually, we have emerging signature, epigenetic signature that we are discovering relating to the level of methylation in some area of DNA, even on the histone. And this can change the expression of gene related to the expression of pro-inflammatory or anti-inflammatory genes, or pro-oxidant and antioxidant genes that can lead to vascular changes like plaque, atherosclerotic plaque, and then subclinical cardiovascular impairment, means no sign, no symptom, no sign, no symptom, and till the onset of myocardial infarction up to the death. This is an interesting experiment where they demonstrate that the particulate, the PM2.5, at increasing concentration can reduce the cell viability. So it means that you have like a bombing effect on the cell. In that case, these are human endothelial cells. But you have even a gene mediated effect. Look in red, the expression of this transcriptional factor is the POSIX related factor. And when the cells are exposed to PM2.5, increase the expression of IF in the nucleus. It means that IF is activated. What is the activator IF? Is a pro-inflammatory cytokine, interleukin 6, the same cytokine that is related in the COVID-19 disease. So if we want to recapitulate the cardiovascular changes following particular inhalation exposure, the associated study detailing these findings, we can say that many studies already they perform in human and animal models. And this picture summarizes what we discover. Look in the small number means each study. So we already demonstrated that the exposure to air pollutant promote the death of cardiomyocyte. We are talking about long-term exposure, like we are living in a place or we are working in a place. And decreased contractility because you have a loss of tissue. You can have an impairment of mitral valve function. You can have an impairment of the structure of the heart, means that the heart become much more hypertrophic, gross, and so you have a difficult of contraction, and you have an increasing of heart rate, but you can have also defect of repolarization of the heart with an higher risk of arrhythmia. And we know that recently events like atrial fibrillation and other disease related to repolarization are increasing. And this is why we are exposed to a new environment due to the climate change. And we have also effect on the systemic vascular system. It means far away from the heart to peripheral organ like the brain, like the kidney, and these are related to less perfusion of this organ with the onset of corresponding failure. And the different study already plan a map of gene that long-term exposure can upregulate or downregulate. Upregulate in red and downregulate in green, and in yellow means genes that have a different profile compared to people not exposed to air pollution. And for example, genes that are overexpressed are related to the inflammation, like NFKB is a transcriptional factor, interleukin 1B, like interleukin 6, as we say before, TNF-alpha that is related to the septic shock. And we have even an increase of angiotensin that we know that is related to an inflammatory and hypertensive. Even hypertension could be related to the exposure of air pollution. And we have a decrease of genes that protect our cardiovascular system, like antioxidant protein, like superoxide dismutase type 1, or VEGF type A, that has even a great role in the angiogenic response following a cell loss into the heart. And thanks to the study, we know the first signature related, the first epigenetic signature, means the chemical modification to the DNA and to the histone protein. Look, the DNA with the double helix, and the histone protein are the blue one, H3, H4, H2A, H2B. And what we observed recently, even when pregnant is exposed to air pollutants, is an increase of DNA methyltransferase enzyme that carry methyl group to specific area of the DNA. So you have not a general methylation, you have a methylation specific site. And these sites are related to this microRNA that is involved in angiogenic response and pro-survival patterns. And you have even other epigenetic modification related to lysine 9 of histone H3 like acetylation that can regulate the expression of two relevant genes related to progenitor cells. And you have an increase due to methylation, lysine 4 of histone H3. You have an increased expression of transcriptional factor pro-inflammatory like STAT3 and IF1 alpha. So we can say that during our epigenetic life, still we are in the uterus of our mom, the exposure to air pollutants that enrich the environment of these years means particulate matter, nitric oxide donors or metals or oxide CO can change the expression of gene into the cells of the offspring and can promote several activation of patterns with the chromatin remodeling that induce the expression of pathogenic genes and downregulate the expression of safe life genes that promote higher or lower susceptibility to different disorders like cardiovascular disorders. In that case, we are talking about transgenerational inheritance. So epigenetic modification promote transgenerational inheritance. Someone has not a gift, you give a gift to him that is not a very good gift due to a long-term exposure to air pollutants. What are the perspectives? Recently, Circulation, that is one of the main lead journal of the cardiovascular science, the official journal of the American Heart Association, published this perspective article. The title is we can talk like a synthesis of the message. The need to expand the framework of environmental determinants of cardiovascular health from climate change to planetary health. So means much more regulation related to much more studies related to risk factor and even environment. So as you can see in this last slide, climate change can promote on our planet different changes like global warming, heat events, and air pollution increase like a synergy the exposure to this killer. And people that are more vulnerable to this exposure are older people. So age is a really important determinant. The socioeconomic status is really important because it depends related to the money to buy good food or buy drugs or take care of your health to defend yourself from this kind of attack. And the health status. So people with comorbidities are much more frail compared to others. So the take-home message is respond to this question: who is at risk of climate change? Everyone, everywhere, like say the WHO. So those living in poverty as well as women, children, and elderly are more at risk. Outdoor workers and people living with chronic medical condition are at higher risk. Children are at most vulnerable due to long exposure to environmental risk. And on the other face of the coin, we should try to reconsider where we live, the workplace, the living place, because we need to counteract the climate change through more regulation, through more focused science related to risk factor, and through more watch organization of the living and workplace. Thank you.
So thank you, Professor Lionetti. Hoping my camera is really slow. So thank you, Professor Lionetti, for your presentation. I'm going to introduce myself as a little bit of resonance and sharing my screen. I'm going to talk a bit about the importance of the stakeholder involvement. Wait. Yeah. Can you see my screen?
Yes.
And also the slide now?
Yes.
Yes.
Okay, in the previous speech, we have learned what planetary health is, and we have understood that our action, the way in which we can act on the environment and on the planet, can affect several generations after us. This concept has a lot to do with intergenerational equity and environmental justice also. So starting from the concept of equity, I have found this graph, which is part of a publication on climate change and social equity. And I found it very interesting because in this graph, I have highlighted the role that health education and climate education have in this complex process. As we can see, the two fundamental elements for the process, which are also graphically central in this image. As Mary well is illustrated, planetary health goes far beyond the concept of climate change and therefore require a communicative approach that is able to illustrate the connection between our health and that of our planet. So how we can communicate this connection? So the field of climate change communication give us some solution and some food for thought, because it is certainly among the field of environmental communication with a very large scientific corpus. One of the most prominent authors in this area, Nisbet, has suggested a series of main frames for communicated climate change. And the literature suggests us that the public health frame, that it's in the social progress frame that I have highlighted in red for you, to communicate climate change is functional as and effective because it solves the main problem that concern the communication of climate change. And it's the fact that climate change has been perceived and is perceived currently today as an element distant in space and in time. So health instead is something close and personal for which we have a direct and immediate interests, because if we do not take care of health, we could have negative consequences in the short period. So we have our key. Here too, I have taken this graph from the same study I was referring earlier. Although the study focused on climate change, this graph offers us an excellent starting point for reflection on planetary health engagement. Every action to address the health of our planet can potentially affect human health for better or for worse. Planetary health action strategy with health co-benefit provide a perfect opportunity to reduce the risk and the effect of climate change and environmental degradation and improve the public health. So some example could be switching to clean energy sources, reduce the household air pollution with contaminant reduction in respiratory and cardiovascular disease, as Professor Lionetti explained, or for example, having green infrastructure in the city can reduce the flood risk and can incentivize physical activity, food production, and reduce the urban heat islands. So one of the current main perspective in planetary health is to put physicians and health professionals at the forefront for this call of action. And I take care of this because this is also a part of my PhD project. So as we know, the word doctor comes from the Latin the meaning is to teach. So in Italian. However, several studies confirm that the doctor-patient relationship is more effective when patients see their doctor as a partner rather than as someone who makes all the decisions in the relationship. The concept of teacher, so this concept we have to translate from a general top-down approach to a bottom-up process where the clinical encounter is a space for different type of expertise. those of the doctor and the patient, to meet and then become integrated and balanced. So, although many of the commitments in the communication process can and should be shared, both parties generally agree that doctor is the one who lead the agenda for the clinical meeting. So why we can put health professional in the forefront? Because there are many evidence that healthcare providers are trusted sources. We have strong data coming from Wellcome Trust Global Monitor that found that globally doctors were considered important and credible sources of health information, and the average of the level of trust can vary from country to country, but stands, the average stands at 73%. So the experience of the individual patient constitutes the basis for the trust accorded to the doctor, who is recognized as having competence in both the health for the individual and that for the community. So, generally, just speaking, giving an historical overview and taking this inspiration also from the book wrote by Samuel Myers, the professor from Harvard and the president of our Planetary Health Alliance. Hippocrates, in his book Air, Water, and Places, he's considered the father of the medicine, made the first systematic attempt to identify a causal relationship between human health and the environment. The human body, he observed, was continually exposed to wind, humidity, and seasonal changes, and it oscillated on a continuum between health and disease. Place and climate were important, because where the presence of a forest or of the sea could give a precise shape to a certain disease. So I would say that the relationship between health and the environment became increasingly important during the colonization from the 15th century because explorers traveled to new and unknown places and could be exposed to disease their body were not prepared for. So medicine became a discourse on how to colonize and settle in new environments where practices like deforestation and new agricultural cultivation methods were introduced. So something changing with the Pasteur theory of germs. With many technological improvements we record in the last century, and because it was clear that the body could be isolated from the surrounding environment, and the interest for the relationship between the environment and the health would decline until to reemerge the Second World War for the nuclear power and the risk that people perceive for this issue. So when the new economic model of consumption and over exploitation of resources reveal the damage being done to the environment, it was clear that we have to take some new decision about the relationship between health and the environment and the position that the physician and in general health professional occupy in this delicate and so important relationship. So the doctor has therefore always been a bridge between the patient and the environment, and the doctor works, I would say, must be inspired by Epigenetic. There are many statements all around the world from health professionals stating that they are working for being active for planetary health. But there are also some, let's say, important milestones. For example, one is the Geneva Convention that promote justice autonomy, and charity for the health professional. And then we have, for example, in Europe, a couple of very important milestones. So the Larnaca Conference and the Conference on Child Health in Budapest, just held 16 years ago, that are examples of commitments made by the medical community in this case. So taking again information from the climate change communication field, the literature showed that the health professionals think that climate change is real, is of an anthropogenic origin, and does and will impact public health. Many doctors say that they have seen already, they have experienced consequences of climate change on health, for example, for the heat wave, for vector-borne illness, and for poorer quality. So they have a good, generally, we have many surveys, and we have many surveys, especially from United States, that confirm that generally doctor feels ready to be an advocate for planetary health and for the issue of climate change. There are a couple of open challenges, one regarding the training and the university curricula, because many of these health professionals don't feel really prepared to face this challenge. And on the other hand, we have to create an adequate social system to promote this change. So just I tried to illustrate what the role of the doctors could be as a bridge between our environment, our health, and the goal for an healthier and more sustainable world. But day-to-day reflection would be that in general, planetary health teaches us that everyone could be a part of the great transition. So my message for today is that this of the health professional is just an example, and me as a PhD scholar and every one of the person that will listen to this webinar could be a part of the solution. Thank you. So thank you, and I think it's time for Mary and for Professor Lionetti to give us a 1 minute take-home message, and then we will go for questions. Mary, you are the first.
Thank you, Sara, and thank you for your excellent presentation, and same with you, Professor Lionetti. That was really informative and very helpful. I think that the take-home message really is we are in an incredible moment in time, right, where we are seeing the enormous environmental disruption of our planet, and we are seeing unprecedented impacts on human health across the globe. And so taking these steps that Sara has outlined, and I hope that maybe we'll discuss further, is really a matter of urgent self-interest, not only for ourselves, but for our children, our grandchildren, and those 7 generations that Sara referred to as well, for the long-term viability of our planet and for human well-being. We really need to step up and think about how we live differently on the planet and how we live within the planetary boundaries. I'd like to really highlight that there are many solutions across different sectors that are starting to come to the forefront, and we just have to be aware of them, and we have to be brave enough to support them and try them out ourselves. And in that line is that I really do want to highlight the co-benefits aspect, that as we start to maybe address something in climate change by reducing fossil fuel use and maybe say bicycling more or some other mode of transportation, we'll not only reduce the greenhouse gas emission, we'll not only reduce air pollution, but we'll also improve human condition based on exercise and so on. So I think really we should really be looking at those co-benefit aspects so that we get positive change, not only for climate change, but across the planet in other environmental disruptions, and at the same time that we improve the health and well-being of people and other beings on the planet.
Thanks. Thanks, Mary. I will give you the stage for the take-home message to Professor Lionetti.
The take-home message is start to be out of the box. I mean, to try to find new solution to disease that sometimes we don't know the cause. We don't know the factor that lead. We need to move observing the environment. If the environment change, the people change. And the Pandora box, as you have written in your slide, is more easy to take if the planet is destroyed. I mean, we are in an environment that is created to have a human being well-being and healthy. And if the environment is totally destroyed, even cause of disease increase. So we need to put climatic and environmental medicine in the educational program of medical students first. And we need to move to find new biomarker of disease related to exposure to the environment. So the question is where you live, how long you live there, and you know the map of the place where you are living. And it could be helpful even to find new regulatory pattern and to help politicians to find a solution, because it is really important to understand where, when, but it is also important to understand how. So, in my opinion, physicians play a key role in this, and the multidisciplinary team should be the new roads to find the answer to disease that now has no more question, but only death and morbidity.
Thank you. I would like just to add before our questions that the Planetary Health Alliance has led an action for push some goals for the new administration, I think, or was part of an action. So I think that there was a multiple action in US now for the Biden administration asking for reaching some sustainable goal. So I think that it's something that it's not sadly happen in Italy at least, but I think in US, Mary, can you confirm or not? You have a lot of activity going on. I mean, health professionals stepping up, professional association of health professionals just clarifying what has to be done. Here it's something that it's not really happen.
Yes, there is quite a big movement, and even within the Planetary Health Alliance itself, we have a working group called Clinicians for Planetary Health. And for example, there's about 1,000 clinicians from 70 countries that are part of the clinicians movement. And one of the things that they're beginning to work on are developing patient-facing materials for that healthcare providers can give to their patients around the world. And so these are patient-facing materials that can be locally developed so that they make sense on a regional or local scale. And there are other examples of that going on as well. So And I would like to just say, if I may, also, there are some really good models. So for example, in Germany, I think they've already begun this, that within the next 5 years, planetary health will be a requirement for all medical students going through the German medical system. So I think, and those things are available, those kinds of examples are available, and we should be looking around to see those examples and try to maybe bring them to our own countries or our own locations to also demonstrate that, look, this isn't crazy and other people are doing it, we can do it too.
Yeah, absolutely. Thank you so much. We have a first question I see from Marco Cervino, that it's one researcher from my institution. Marco asked, I see that Isac is a member of the Alliance. What an Isac researcher may do with Alliance and vice versa? Mary, please, it's your time.
Yes, thank you for that question. So we really facilitate work on 3 different levels. And so we work to curate research and knowledge that's related to planetary health and provide that to our community through the form of our newsletter and in our research bibliography. And then we work in education, and so developing in some ways, in some instances, actual curricular material, but also really supporting the growth of other institutions to create educational materials and resources. And we collect those in our education database and also have conversations with our colleagues to support them in the development of those planetary health research resources. And then we build a community as well. And that's the community that I've mentioned is on Hilo, which is our online community platform. So as a researcher, I think a couple things that can happen is certainly as you do your research, you can share your articles to the PHA, and we will help disseminate those through our newsletter and through our social media and other mechanisms. The other piece is you can join by joining up as well as an individual member, you can get onto our online community, and we hope to have an active community of researchers on Hilo who can potentially share information and have conversations. As a researcher as well, if there are outcomes of your research that might be valuable, turning into educational materials, or also might be very important for, policy or so on, then we certainly encourage you to think about how you take your research and make it accessible to either the educational audience or to the public policy or general public.
Thank you so much. I have a message from Professor Lionetti that no, there is no.
I want to add something relating to education. At Scuola Superiore Sant'Anna, we engaged a program related to focus on climate change, and we have opened the roads to a new program of education for medical students, focusing on climate and environmental medicine. So I think that if you have the opportunity to enforce much more time to dedicate to education opportunity. I mean, even in Italy, in other occasion, maybe with the help of the Planetary Alliance, with the help of the CNR, maybe other university in Italy will join us to open this educational pattern.
I mean, now to the question, just want to add that the university where I studied, where my PhD has based, University of Bologna, has just opened a new department of planetary health, and
Great.
I mean, my thesis is in this. I mean, is on planetary health on the pediatric side, but we hope to could have maybe a pilot in the future, have maybe testing what is the effect of the introduction of some curriculum. I'm just saying what is in the air. It's not, nothing is written, but we could hope to have a pilot in the future to test how the students can perceive, could welcome this type of content. I would like now to have more, maybe some more questions from the people that are joining our.
Sarah, if I
Yeah.
might just mention, I just put into the chat
Yeah.
2 examples of that came out of the Planetary Health Alliance or the Planetary Health community. One is a pledge for planetary health to unite health professionals in the Anthropocene. And this is as health professionals, graduate or move out into the world, this is a pledge that they can take in order to really say that not only will they, take care of their patients, do no harm to their patients, but also be aware of the implications of the impacts of a changing planet and changing environment on their patients. So that's a pledge. For that, we also would love it if this pledge were taken and modified for other professions. So it could be engineers could do this, or educators or others, other professions could modify this pledge in the recognition of the importance of planetary health. The second link that I put in there is called Young Academics Ask Universities to Act. And this is something that if we have, students on this call or people in universities, do have a look at this. And it's a lovely framework to be taken to your university to say, look, not only do we need planetary health course and department, but really we need to use the planetary health framework as an operational framework for our entire university, right? So that our university looks at its supply chain, looks at how it operates, looks at where it gets its fuel, looks at what food it serves, and the green spaces or available spaces for everyone to join. So those are just 2 concrete examples that people can look at. They're both from the Lancet Planetary Health Journal.
Thanks so much.
So Sara, I'm sorry, even me, they are calling me in the clinical round.
Yeah.
So I must leave, and I will be an opportunity to be in touch with you, Mary, and to continue to be in touch with you, Sara. I'm sorry for the audience, but they call me in intensive care, so I must go to the unit now. Okay?
Thank you, Professor Lionetti. It was a pleasure to meet you. So,
okay,
yeah,
me too.
Mary.
Thank you very much.
Bye. So, Mary, I hope, just wondering if we have some more questions maybe from the audience. Let's see if someone wants to ask something. So,
yes, please. And I guess I also want to make sure that we, as we move forward in this desire to create planetary health for the future, that as we do that we also really bring in youth voices, right? So that's why students are so important, but even younger students, because it's really their future that we're talking about. And so let's make sure to give them voice as we develop new systems and as we think about the world in which we want to live. I heard something really terrific, which is, let's not build back better, let's build forward, right? So let's not necessarily keep the mindset that we've always had. Let's maybe think about a whole new mindset as we move forward.
I have a question because it's a reflection. A reflection, because talking with my tutor, that it's Dr. Paola De Nuntis, that is present in the room, we talk about also, people know about climate mainly from newspaper, from TV. We know that mass media are today the man, and so they learn also things about planetary health from the TV and from the newspaper and magazine. So why we are talking so few about the solution? Because it's a real problem. I mean, we are sometimes we are taking the discourse on a theoretical level, and this amplify the sensation for the person that it's something far. I mean, giving them solution, it giving me the opportunity to feel something close to me and something affordable. In your experience as an expert, why we are talking so few of the possible solution?
I think it's a great question, and I wish I knew, and I wish I could solve it. Because the conversation around climate change has been going on for decades, and yet we haven't really made big strides. I think one of the beauties of planetary health is that it talks about all those environmental disruptions with that connection to human health, right? And as you mentioned earlier, health is something that's very personal, and it's a very personal interest. It seems like who could be against the health of yourself and your family and your children and so on. So I think that gives us a little bit more of leverage. I think also in planetary health, and we're gonna try this out, is it remains a field full of hope, right? And so we want to work with everybody to imagine a brighter future. And so we don't want to, yes, there's some enormous and devastating challenges out there, but if we just focus on those devastating challenges, we won't be able to take the next step toward a brighter future. So I think we have to also, you know, frame it a little bit differently in terms of deciding about the world we can have. I do think that there seems to be an enormous movement around the world today across sectors, whether it's policy, private sector, general public, academia, starting to really recognize the severity, if you will, or the urgency and the scale of the problems. And so I am hopeful that we can pull together and identify these solutions and really be positive about it. There's, for example, there's a great example in Wales, right, which is in the UK.
How do you mean the fact that the whale could help the storage of carbon? You mean this one,
Well,
or?
that, but also they actually, in 2015, their legislator, their government passed the Well-Being of Future Generations Act, right? So on a policy level, now at the country level, they need to consider future generations in all the decisions that they make. And
Yeah.
so I think that by doing that, that just becomes, the conversation becomes much more broad, not only within policymakers, but mainstreaming it to the general public and putting that perspective on future generations.
Okay, so Mary, if you agree, I will close the, since we have a couple of questions, and I don't know if you want to add something, because I mean the video will be available for the Green Week and for the